What causes a yeast infection? A yeast infection, also known as candidiasis, is caused by an overgrowth of yeast, specifically a fungus called Candida, in the body. Candida is naturally present in small amounts in various parts of the body, such as the mouth, intestines, and genital area. However, certain factors can disrupt the balance of microorganisms in the body, leading to an overgrowth of yeast and the development of an infection. Some common causes and risk factors for yeast infections include 1. Antibiotics. The use of broad-spectrum antibiotics can kill both harmful bacteria and beneficial bacteria that normally keep the yeast population in check. This disruption of the microbial balance can allow the yeast to overgrow and cause an infection. 2. Weakened immune system. A weakened immune system due to factors like illness, stress, or certain medical conditions, such as HIV/AIDS, can make a person more susceptible to yeast infections. 3. Hormonal changes. Hormonal fluctuations during pregnancy, menstruation, or hormonal therapy, such as birth control pills, can disrupt the vaginal environment and increase the risk of yeast overgrowth. 4. Diabetes. Uncontrolled or poorly managed diabetes can create an environment in which yeast can thrive. High blood sugar levels can promote yeast growth. 5. Sexual activity. Sexual activity, particularly with a partner who has a genital yeast infection, can increase the risk of developing a yeast infection. However, yeast infections are not classified as sexually transmitted infections, STIs, because they can occur without sexual contact. 6. Tight or irritating clothing. Wearing tight-fitting or non-breathable clothing, such as nylon underwear or wet bathing suits, can create a warm and moist environment that promotes yeast growth. 7. Weakened skin integrity. Skin damage or irritation, such as cuts, abrasions, or diaper rash, can provide an entry point for yeast to invade and cause an infection. It's important to note that yeast infections can occur in different parts of the body, including the mouth, oral thrush, genital area, vaginal yeast infection, skin folds, and nail beds. The specific symptoms and treatment may vary depending on the affected area. If you suspect a yeast infection, it's advisable to consult a healthcare professional for proper diagnosis and treatment. They can recommend appropriate antifungal medications, lifestyle modifications, and preventive measures based on your specific situation.